السلام عليكم طلاب المرحلة الثانية. اليوم محضر لكم بموضوع البارشل دنتشر لكتشر نمبر 2 واللي هي على الأكريليك بارشل دنتشر. Acrylic partial denture as a definition, we may define it as it is a dental prosthesis that substitute teeth and associated structure in a partially edentulous arch, and it is made of acrylic and can be removed and replaced by the patient. Now, if we look at the component of the acrylic partial denture, it is composed of acrylic resin denture base, هذا اللي هو main body of the partial denture, and it consists of artificial teeth, the second component, and a wrought wire clasp, and sometimes it may be a cast clasp. Now, there is something I would like you to draw your attention about. When you say types of partial denture, what do we mean by types of partial denture? Mostly we mean the material, that which type of material the partial denture is made. We have the acrylic partial denture, we have the metal partial denture, which is usually chrome cobalt or titanium or any other new metal partial denture, Vitalium. All sort of now recently metal partial denture can be constructed. The other part is the flexible partial denture. So these are the types of partial denture as a material: acrylic, metal, and flexible. But when we say type of acrylic partial denture, we specifically indicate that these partial denture are made wholly from acrylic. They may come into 5 types. It is a temporary removable partial denture, an interim removable partial denture, transitional partial denture, treatment partial denture, immediate partial denture. Now these types of partial denture, they may correlate to each other, as it is not easily to distinguish between each one of them because they resemble each other in use. يعني واحد يشبه الآخر بالاستخدام. So we start with a temporary removable partial denture. المؤقت. It is a removable prosthesis that is used temporarily for a period of time until a more definitive prosthesis is provided. يعني مثلا هنا patient has lost 2 teeth, central and lateral, so we construct for him a partial denture يلبس لفترة من الوقت، لأنه it is a possibility أنه we might make a bridge or we might make an implant, but the time has not come for the patient to decide, so he wears this partial denture for a period of time, unlimited period of time. Here losing 2 premolars, substituting a canine and a molar. There is more than one possibility، اكو اكثر من خطة علاج لهذا المريض. Until we reach a definite treatment plan, we make this temporary partial denture. The second type is the interim removable partial denture. هنا partial denture هذا is used for a short period of time، عكس temporary ذاك for a period of time، هذا short period of time. The reason we do this أنه we need to help in mastication. As you see here, a lot of teeth are extracted. The patient is in need of mastication. For reason of aesthetic، هنا هذا lateral canine is showing، إذن it has aesthetic. And for the reason of occlusal support. Of course لما عندنا هالقد أسنان مفقودة، إذن ال opposing teeth need to be occlude. هاي artificial teeth needs to occlude with the opposing teeth. إذن عندنا mastication, occlusal support, and aesthetic. The patient uses this prosthesis until more definitive prosthesis is made. other type of the acrylic partial denture is the transitional removable partial denture. هذا البارشال denture used when loss of teeth is expected، يعني نتوقع انه تنفقد اسنان. For example here احنا مسوين partial denture معوض ال 4 anterior teeth. هنا هاي التيث might be involved in periodontal disease. We expected that it might be lost in the future, so we can add high lost teeth to this existing partial denture. Again here هنا a partial denture، هذا teeth is lost, we add it and this has been changed into a denture. You can see here هذا old partial denture، هذه claspers showing. So this means this partial denture started with a few teeth and it ended up with a denture. بدأ بطخم جزئي وانتهى بطخم كامل، فذلك it is called transitional، يعني يوديك من حالة إلى حالة. The other type of the partial denture is a treatment partial denture. هنا this is used in more than one case. For example, sometimes the patient uses their partial denture for a long time and they don't wear it. Usually it causes an inflamed gingiva like you see here. So we use the same existing partial denture and we use this what we call tissue conditioning material to be realigned with the denture، وعادة هاي تتبدل every 3-4 days until the tissue become normal. Then we construct البارشال الجديد. فإذا أول استخدامه in inflamed tissue. The other uses for treatment partial denture when we have a patient like this and a lot of treatment in the lower jaw and the upper jaw، وهاي treatment might take months to be finished to occur more than one possibility for the treatment. يعني we end up in a nice partial chrome cobalt partial denture like this. Occlusion is corrected, bad teeth extracted, carious teeth حشيناها. Until we reach the final stage of the treatment we construct a partial for the denture اللي نسميه treatment partial denture. إذن والother use هو as an aesthetic guide. يعني for example إذا patient losing his anterior teeth we want to make an idea، نريد نسوي فكرة عن نهاية العلاج اللي ممكن تصير، فنسوي هذا partial denture in order to make an idea about how the final prosthesis is going to look، شلون راح يكون شكل الفاينل prosthesis. فنصنع هذا partial denture ونسوي فكرة على end result whether we keep it as a partial أو نسوي implant أو نسوي bridge. إذا يعتبر نوع من أنواع treatment partial denture. Inflamed tissue, long treatment and for aesthetic reason. last type of the acrylic partial denture is an immediate removable partial denture. If we want to define immediate partial denture نقول عليه it is a partial denture fabricated before extraction of teeth and inserted in the mouth immediately after extraction of teeth. يعني هنا يصنع partial denture يصنع قبل أن تقلع الأسنان. Sometimes usually خصوصا إذا البيشنت كان young والteeth which are involved or need to be extracted for any reason periodontal trauma we need to extract it. يعني ما يجوز أنه نشلع هذه الأسنان ويبقى المريض بدون أسنان أمامية. So what we do طبعا راح تأخذوها بعدين بالتفصيل بالمراحل السنين القادمة. We make impression ونبدي we remove the teeth from the cast and we set the artificial teeth which are going to be extracted. وهاي الانterior teeth هي راح تعتبر إنها as a guide regarding the size, the position and the color. Usually we should set it in the same way as the teeth that are going to be extracted. When the partial is ready, the teeth are pulled out, and immediately the immediate denture is placed in a place here, which almost it is identical to what the patient had. And now here, this partial denture now, it is an immediate, but he's going to wear it for a period of time, so it might be transitional partial denture until we reach a more definitive treatment. Or when we are going to use tissue conditioning material, then it is called a treatment partial denture. That's what I said in the beginning of the lecture. And هاي partial denture يعني they resemble each other in use. An immediate denture might be regarded as a treatment partial denture, and might be regarded as a transitional partial denture. Now here, if we want to make an advantage and disadvantage of the acrylic partial denture, of course it is one of the advantage, it is light in weight, good appearance, تعطينا يعني good aesthetic. It is not expensive و easy to construct and repair، ما بها خطوات هواية بالتصنيع، وبها خطوات مختبرية أقل مقارنة بالكروم كوبالت، و less time consuming. الديسادفانتج it is a poor thermal conductivity، ما توصل حرارة وبرودة مثل الأكريليك بارشال دنشر. It is low strength يعني easily broken لأنه مصنوعة من أكريليك مو مثل الميتال. less hygienic يعني بقايا الطعام stick to it easily، فيكون إذا ما ينظف المريض راح يكون صعوبة التنظيف مالته. و tendency for damage if overheated يعني من أثناء عملية التصنيع، إذا أثناء البوليشينج عرضناه إلى سرعة عالية فممكن يصير به دامج بالبارشال دنشر. هذه تقريبا كل اللي ردنا نقوله بهاي المحاضرة، وإن شاء الله تستفادون من عدها، ونتلاقى في محاضرات أخرى. والسلام عليكم ورحمة الله.